Best Practice Guideline, Person and Family-Centered Care for Periculture Center and Maternity Hospital. Prepared and presented to you by Group 1. Members: Juveros Yi, Pooja Rani, Sumant Kaur, Pravin Sebastian, Harmanjit Kaur, Manjinder Kaur. After this presentation, you will be able to identify recommendations used for implementing person and family-centered care. You will be able to recognize and provide feedback for the created evaluation tool. You will be able to describe person and family-centered care in an easier way for the patient and family. You will be able to provide an overview of how person and family-centered care is adopted and practiced. To start, this presentation is based on the following recommendations. First, incorporate a patient and family-centered care philosophy into the mission, vision, and goals, definition of quality care, strategic plans, and personal practices in the facility. Next is to encourage patients and families' participation in policy and program development, such as facility design, patient and family education, strategic planning, and patient safety. Another recommendation is to promote patient and family involvement in healthcare orientation and continuing education. Next is to initiate a patient and family rounds for care coordination and clinical teaching. Then share details and teachings for healthcare providers, staff, administrators, patients, and families for creating and strengthening strong partnerships. Then lastly, allocate incentives, benefits, and rewards for perinatal staff and other affiliated institutions implementing patient and family-centered care. This is the tool that would evaluate how the hospital and staff have demonstrated person and family-centered care throughout patient and family interaction and hospital stay. This helps provide feedback and address gaps that needs to be improved for a better health service. This is the health education brochure to help the clients, family, and visitors understand person and family-centered care. This brochure gives an overview of the mission, vision, and values of the hospital and what the clients would expect from us with this approach. In order for Periculture Center and Maternity Hospital to adapt a person and family-centered care, encouraging family participation and involvement policy has been created. This serves to delineate patterns of behaviors and healthcare procedures in the facility to bring respect and honor to patients and families' concerns and point of views such as their perspectives, values and beliefs, culture and preferences, to improve partnerships between staff, patients, and families to deliver a quality, safe, and effective care. This policy helps embrace the holistic approach for patients and families as unique individuals who are considered as recipients of healthcare services with respect and dignity in maintaining the quality of life. This policy applies to patients and their families, the nursing staff, the registered nurses and the registered practical nurses, nurse practitioners, midwives, consultants, physicians, volunteers, and all other individuals working in the facility. An empowering partnership between these individuals makes a collaborative relationship that is built on mutual respect and trust, sharing of information and skills, attitude, and experiences. Therefore, families, nurses, and other healthcare team members are empowered to grow and learn together as partners in one common goal, which is to promote effective, efficient, and an individualized care plan with the patient. For this policy to be successfully adopted, the facility should follow safety and effective guidelines for rendering services and adopt administrative policies and bylaws governing safe facility operation. Registered nurses and registered practical nurses are nursing professionals who are responsible for primary interaction with the patient and family. They also act as advocates for the patient and family. Nurse practitioners are registered nurses who have met additional nursing education, experience, and exam requirements set by the college. Patient is the person who is needing healthcare and has the authority to make a decision on his own plan of care. Family are responsible to be honest and share their knowledge and caring expertise about the patient. To carry out this policy, the succeeding procedures is imperative to be followed. First, establish a trusting relationship with patient and family. Mutual respect and trust should be immediately established at the earliest interaction with the patient and family. Next is start with open-ended questions and minimize usage of closed-ended questions. This allows family and clients to give spontaneous answers, which gives them opportunity to be heard and voice out their opinions. Next is evaluate readiness of patient and family to be involved in the plan of care. This assesses patients' and families' understanding of what it means to be involved in the planning and implementation of care. Fourth is assess the different factors and possible barriers to create a conducive partnership. This addresses the identified possible barriers that may hinder the patient and family to be involved in the care. Next is promote partnership by letting patient and family understand that they are part of the healthcare team. Patient participation causes improved health outcomes, enhanced quality of life, and delivery of more appropriate and cost-effective services. If patients are regarded as equal partners in healthcare, they would actively participate in their own healthcare process and more carefully monitor their own care. Next is encourage family support and develop families' confidence to share information and expertise in caring for the patient. The family constitutes an important source of psychological stability for the patient, as well as a good source of support for better recovery. And lastly, maintain an environment that facilitates a patient and family-centered care. Definition of terms. Family refers to the persons whom the individual receiving healthcare services is related to or has a close relationship with. This includes friendships, commitments, shared households, and child-rearing responsibilities and romantic attachment. Patient refers to any person whom healthcare providers create a therapeutic relationship with for the goal of becoming partners to wellness.